Disease overview. Mutations in TWIST2 also cause the Barber syndrome and Setley's syndrome, which have very similar features. Indeed, it has been suggested the three disorders in fact form a continuum. De Maria 2016. Signs and symptoms. AMS is apparent at birth from features of the head and facial, craniofacial region. The abnormalities around the eyes, poor eyelid development and absent eyebrows and eyelashes cause the upper and lower lids to turn outwards. Ectropion, exposing the inner mucous membranes and prohibiting complete closure of the eyes. Lagophthalmos. Infants affected with AMS may have additional characteristic craniofacial features. Zygomatic arches are the two bony arches spanning from the lower portion of the orbits of the eyes, across the prominence of the cheekbones to the bones forming part of the lower skull. The absence of the soft, downy hair at birth that typically covers most of the body. Lanugo. Sparse scalp hair, redundant and wrinkled skin, small or absent nipples and underdeveloped genitalia can be found. Unusually formed genitalia can include undescended testis, cryptochordism, urethral opening on the underside of the penis, hypospadias, and a small penis in males or small labia minora in females. Causes. AMS is caused by changes, mutations, in the gene called TWIST2. The mutation has often occurred spontaneously in the affected individual, so not inherited from one of the parents, but inheritance from one of the parents in an autosomal dominant pattern has been reported. Affected populations. Between 1977 and 2020, there have been 16 documented cases of AMS in the literature and a worldwide prevalence of less than 1 millionth. No apparent sex or ethnic disparity exists, and males and females present with similar signs and symptoms. Disorders with similar symptoms. Diagnosis. A diagnosis of AMS may be suspected at birth based upon a thorough clinical evaluation, a detailed patient and family history and identification of characteristic physical findings. Typically, a reliable diagnosis is possible on clinical grounds only. The clinical diagnosis can be confirmed by molecular genetic testing for mutations in TWIST2. Clinical testing and workup. Computerized tomography. CT scanning may be helpful in demonstrating absence of the zygomatic arch, improper union of portions of the upper and lower jawbones, maxillary and mandibular prominences. Although this rarely will have consequences for management, thorough examination and specialized testing may be conducted by eye specialists, ophthalmologists, to appropriately characterize eyelid characteristics, detect any additional or associated eye abnormalities and ensure appropriate preventive steps or treatment. Corrective surgery can also be pursued for the fingers, skin, or ears, but there is minimal evidence to support this. These surgical procedures include local flaps, facelift procedures, forehead lifting, Botox injections, fat grafting, orthognathic surgery and nasal reconstruction with rib cartilage grafts. De Maria 2016. Psychosocial support for children with AMS is also important as they grow and face the societal pressures related to physical appearance. Testimonies from individuals with AMS report positive experiences from corrective surgery and emphasize the importance of building self-esteem and having continued support from family members. Genetic counseling is recommended for affected individuals and their families to understand the genetics and natural history of AMS, and to provide psychosocial support. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.